Hello, yeah. Today we are going to discuss about the anatomy of the posterior abdominal wall. The first topic is the thoracolumbar fascia and the posterior abdominal wall. In this topic, we are going to discuss about first the definition and boundaries of the posterior abdominal wall. The posterior abdominal wall represents the posterior boundary of the abdominal cavity, and it's composed of skin, superficial fascia, muscle, extraperitoneal fat and fascia, and the parietal peritoneum. It also includes the vertebral column and the paravertebral muscles, but not typically included in this context. So the posterior abdominal wall represents the posterior boundary of the abdominal cavity. It's composed of skin, superficial fascia, muscle, and extraperitoneal fat and fascia, and the parietal peritoneum. What are the continuities of the posterior abdominal wall? Superiorly with the posterior thoracic wall via the posterior attachment of the diaphragm. Inferiorly with the posterior wall of the pelvis. Laterally with the anterolateral abdominal wall. Now, regarding the retroperitoneum, it's a 3D compartment. What are the boundaries of the retroperitoneum? Anteriorly, parietal peritoneum of the posterior abdominal wall. Posteriorly, depends on the psoas muscle or the quadratus lumborum muscle, and superiorly we have the diaphragm, and inferiorly and laterally it's continuous with the extraperitoneal connective tissue of the pelvis and the anterolateral abdominal wall. What are the contents of the retroperitoneum? Contents kidneys, ureters, suprarenal glands, duodenum, pancreas, ascending and descending colon, blood vessels, nerves, and the mesenteries. What are the contents? Ureters and kidney, suprarenal glands, duodenum, pancreas, ascending and descending colon, the part which goes up and the part which comes down, and mesentery. Alright, that's the definition and boundaries of the posterior abdominal wall. Now we can discuss about thoracolumbar fascia. What is the composition of the thoracolumbar fascia? It has a complex arrangement of fascial layers. Most prominent at the lumbar spine. What are the layers of it? There are three. There's posterior, middle, and anterior. You'll start from the posterior layer. The posterior layer has attachments. What are those attachments? Medially, spines of the lumbar vertebra and the supraspinous ligament. Posterior layer has attachments. What are those? Spines of the lumbar vertebra and the supraspinous ligament. Then the superficial lamina. What's that? There's superficial lamina, deep lamina. The superficial layer and the deep layer. Superficial layer is attached to aponeurosis of the latissimus dorsi. The deep layer covers the posterior paraspinal muscles. So the posterior layer of thoracolumbar fascia attached to medial spines of the lumbar vertebra and the supraspinous ligament. There is superficial lamina and the deep lamina. Superficial lamina is the aponeurosis of the latissimus dorsi muscle, and the deep lamina covers the posterior paraspinal muscles. What about the middle layer? Middle layer of the thoracolumbar fascia attached medially to the tips of the transverse process. Posterior layer medially attaches to spines of the lumbar vertebrae. The middle layer attached to tips of the transverse process of the lumbar vertebrae. Laterally, it is behind the quadratus lumborum. Inferiorly, there's the iliac crest, and superiorly, lower border of the 12th rib, T12, 12th rib. Now, the middle layer, again to recap, attached to medially tips of the transverse process of the lumbar vertebra, laterally behind the quadratus lumborum muscle, inferiorly to the iliac crest, superiorly it has the lower border of the 12th rib. What about the anterior layer of the thoracolumbar fascia? It covers the surface of the quadratus lumborum. Anterior surface of the quadratus lumborum. Now, check carefully. The middle layer is behind the quadratus lumborum. Anterior layer covers the anterior surface of the quadratus lumborum. What are the attachments of the anterior layer of the thoracolumbar fascia? Medially to the transverse processes of the lumbar vertebra. That's behind the psoas major. Behind the psoas major. So look up. Tips of the transverse process of the lumbar vertebra. That's middle layer. Over here, anterior layer attached to transverse process of the lumbar vertebra, and it fuses with the transversalis and transversalis fascia and the transversus abdominis aponeurosis, and the inferiorly it is attached to iliolumbar ligament and the iliac crest. Iliolumbar ligament and the iliac crest. There's another one attached to the iliac crest. That's the middle layer. Also the anterior layer superiorly to 12th rib and L1 transverse process forming the lateral arcuate ligament of the diaphragm. So in an MCQ they ask, the anterior layer of the thoracolumbar fascia forms the lateral arcuate ligament of the diaphragm. It's true. Now the next point, the fusion of the thoracolumbar fascia. Posterior and middle layers fuse at the lateral raphe. Posterior and the middle layers fuse at the lateral raphe, forming the osteofascial compartment around the paraspinal muscles. The anterior layer fuses with the aponeurosis of the transversus abdominis at the lateral margin of the quadratus lumborum. To make it clear, the posterior and the middle layers fuses at a lateral raphe. It forms osteofascial compartment around the paraspinal muscles. The anterior layer, it fuses with the aponeurosis of the transversus abdominis at the lateral margin of the quadratus lumborum. Now, the next part is the iliopsoas fascia. We have discussed about the definition and the boundaries of the posterior abdominal wall, thoracolumbar fascia. Now the iliopsoas fascia. Iliopsoas, there are two parts. Psoas fascia, iliac fascia, psoas fascia. What about the psoas fascia? Psoas fascia is the dense layer covering the anterior psoas major. The dense layer covering the anterior psoas major. What are the attachments of the psoas fascia? Medially to the transverse processes of the lumbar vertebral and the lumbar vertebral bodies and tendinous arches. Medially to the transverse processes and the lumbar vertebral bodies. Superiorly merges with the medial arcuate ligament. Inferiorly extend into the thigh. How? Surrounding the iliopsoas tendon. What is the clinical relevance of it? Psoas abscess can track along the muscle within the fascia and we point in the groin. Psoas abscess, TB abscess, tuberculosis abscess in psoas muscle, that can happen. So the psoas fascia is a dense layer covering the anterior psoas major. What are the attachments? Medially to the transverse process and the bodies of the lumbar vertebra and tendinous arches. Superiorly, it merges with the medial arcuate ligament. Inferiorly, extends into thigh, surrounding the iliopsoas tendon. Clinically, you can check for abscess. Now, the second part of it, iliopsoas fascia. You have covered the psoas, now the iliac fascia. It covers the iliacus muscle. And the attachment superiorly to the inner aspect of the iliac crest. Repeat with me. Superiorly to the inner aspect of the iliac crest. Laterally fuses with the femoral sheath in the thigh. Medially blends with anterior layer of the thoracolumbar fascia. Over what? The quadratus lumborum and the psoas fascia. So again, to recap it, iliac fascia covers the iliac muscle. What are the attachments? Superior to the inner aspect of the iliac crest. Laterally fuses with the femoral sheath in the thigh. Medially blends with the anterior layer of the thoracolumbar fascia over the quadratus lumborum and psoas fascia. What are the nerves? That iliac fascia contains? Contains femoral nerve and lateral femoral cutaneous nerve. Two femoral ones. What are those? Femoral nerve and the lateral femoral cutaneous nerve. What are the clinical use of it? What's the clinical use? Well, it is targeted for nerve block. Now we move on to the next part with the next video. Thank you very much.